Turnell Valley District. That's because there's not enough rehab specialists, such as physiotherapists, special educators in rural areas, long distance to urban centers, and cost is very high. So Amar Seva Sangam decided to use a community-based rehabilitation model, which Mr. Shankaraman described, which is from the World Health Organization, a strategy to increase services in resource-poor areas such as rural areas. In 2014, we created a mobile app called the Mobile Village-Based Rehabilitation Early Intervention Application. This app is a mobile app that helps facilitate the therapy planning and monitoring, and it connects rehab specialists with community workers and families so that therapy can be provided. It provides access to all families, it's free of cost, and the focus is on rural and people in poverty. Initially, funding came from Handicare International in Canada, and Government of Canada through Grand Challenges Canada has also given funding. We have a number of other funders, including Azim Premji Foundation, and the Tamil Nadu government is coming on board to help fund this project in this year so that it can be expanded further. And I'll talk more about that. We're doing a lot of research for this project so that way we can have the best outcomes. Our research partners are University of Toronto and McGill University in Canada, the Saving Brains Partnership and Harvard University, and the Massachusetts Institute of Technology. So we have some very high-level partners here. This is a description of how the program works. Children in the general community are screened using our app in primary health centers and Anganwadi schools for developmental delays. Once they are screened positive, they are assessed by our team of rehab specialists, which contains physiotherapists, speech trainer, and special educator. Once the delays are diagnosed, a treatment plan is made. And this plan is made in the app that we've created. So there's particular therapy modules for every type of disability. Then community rehabilitation workers who we've hired go and perform therapy in the child's home. Every 6 months, a reevaluation occurs from the rehab specialist, and it's all inputted in the app. When the community rehab worker goes to a child's home, they use the GPS for check-in and check-out function. So that way we can track every visit. So whether the visit was completed, how many hours they spent in the child's home, it's all tracked very rigorously. And every 6 months, the treatment plan and goals are reset. We also have awareness programs for the community. This is in order to increase awareness in the community of what early intervention is, what child development is, what delayed development is, and to reduce the stigma in the community. We also have training workshops for caregivers, community rehabilitation workers, rehab specialists, Anganwadi workers, and nurses. And we also can conduct medical and surgical camps for all the children in the program. So since 2017, we've screened more than 50,000 children in the community, trained more than 2,700 Anganwadi workers, nurses, and community rehab workers, and provided therapy for 1,252 children. We have trained more than 1,500 caregivers, more than 33,000 people in the community have attended awareness programs, and we provided medication and surgery referrals to 98 and 581 children in the program. We cover all forms of disabilities. Here are some examples: cerebral palsy, speech and language disorder, cognitive impairment, autism, orthopedic disability. Here's some of our research findings. Through the awareness programs, communities' awareness has increased and their knowledge has increased significantly, and stigma has been reduced. Initially, when we started the program, only 60% of booked visits were being completed. But through the awareness program and our efforts, and through the tracking of the community workers through our app with the GPS-enabled function, we've improved the program engagement to 95%. Over the last